Before we get into specific organs and how they're controlled by the ANS, let's take a look at the receptors, the names of these receptors, and how we might affect these receptors using medications. So I'll kind of point to these drawings again. This is a sympathetic pathway where we have a preganglionic neuron releasing acetylcholine, postganglionic neuron releasing norepinephrine. The receptors, right? So the effector cell has to have a receptor for norepinephrine, and then this postganglionic neuron has to have a receptor for acetylcholine. If it's a receptor for epinephrine or norepinephrine, they're called adrenergic receptors. So that's what these would be, adrenergic receptors. The subclasses of adrenergic receptors are alpha and beta. So if you ever see alpha receptor or beta receptor, you should immediately think epinephrine and norepinephrine receptors. There's even subclasses of these subclasses. So you've got alpha 1s, alpha 2s, beta 1s, beta 2s. We're not going to go that deep into it, but what I want you to remember is if you see an alpha or beta, those are adrenergic receptors, meaning they are stimulated by epinephrine and norepinephrine. In the medical world, some medications will stimulate these receptors. So they are called agonists. So you could be an alpha agonist or a beta agonist, which is nice because you might be able to target a specific organ if you know exactly what type of adrenergic receptor it is. You could design a medication that's targeted to that organ. All right. If you block a receptor, we call you an antagonist or a blocker. So we've got alpha antagonists or beta antagonists, or also called blockers. So these are medications that will block the receptor and prevent epinephrine or norepinephrine from stimulating those receptors. All right. And this middle panel, this is that one exception. So I'll remind you of this in a minute as well. But if you're a sweat gland, so this is a cell of a sweat gland, you actually don't have adrenergic receptors. You have cholinergic receptors because the neuron that stimulates sweat glands, even though it's sympathetic, it releases acetylcholine. So this is one exception to the rule that postganglionic sympathetic neurons release norepinephrine. This one releases acetylcholine. If you are a receptor for acetylcholine, we call you cholinergic. All right. Cholinergic receptors have two categories, nicotinic and muscarinic receptors. So same thing. If you see the word nicotinic, you should immediately think that's a cholinergic receptor. Or if you see muscarinic, you should think it's a cholinergic receptor. Notice that in the ganglia, all right, you're going to have nicotinic receptors, whereas at the effector cells, you're going to have muscarinic receptors. All right, slightly different receptor, named based on the fact that nicotine binds to nicotinic, and a molecule called muscarine binds to muscarinic. In the medical world, we can design agonists. So cholinergic agonists will stimulate the receptors. And then we can design antagonists, but we usually don't call them antagonists. You'll see anticholinergic as opposed to antagonists. But an anticholinergic medication or drug will block cholinergic receptors. All right, so now we know a little bit about the receptors and some of the terminology. The rest of this PowerPoint is all about looking at specific organs and learning what does the sympathetic division do to that organ. Again, that would be during fight or flight or an E situation. And then what does parasympathetic do to that organ? That would be more during a rest situation. So the first one we're going to look at happens to be in the integumentary system. So this is a system we've done. And then we're going to look at sweat glands. So sweat glands, so if you remember this drawing, that's a sweat gland down there. It has sympathetic neurons going to it. It actually does not have parasympathetic. And when you have sympathetic activity, again, fight or flight, E situations, stimulates the sweat gland, but it stimulates it with acetylcholine. So the sweat glands have muscarinic acetylcholine receptors. All right. So again, this is one of those exceptions to, the fact that sympathetic uses norepinephrine. Clinical connection, Botox. Remember what Botox does? It blocks the release or the exocytosis of acetylcholine. So you could use Botox injections to decrease sweating. All right. So that's a little clinical connection to this regulation of sweat using sympathetic stimulation. Next one we're going to look at is mucus, nasal mucus. So why did I pick this one? Well, there are medications that reduce mucus secretions. Mucus secretions are reduced by sympathetic stimulation, but increase with parasympathetic stimulation. All right? So that's how mucus is controlled. Now, think about, some of your medications. We like to give decongestants and medications that reduce the production of mucus. You could do that two different ways. You could give or design or engineer an anticholinergic. So if you're an anticholinergic, you block the parasympathetic stimulation. So you're not going to increase secretion, you're going to reduce mucus secretion. Then there's a number of medications that are alpha-1 agonists. So remember, alpha tells you it's adrenergic. Agonist tells you it does the same thing. So the ingredient in Mucinex and Sudafed act just like sympathetic stimulation. All right, they're agonists. They mimic it. So they can reduce mucus production. All right. So there's an example of knowing a little bit about the autonomic nervous system and then connecting it to some medications that are out there. Next one are your eyes. All right. We just got done talking about eyes in the previous chapter and the fact that dilation and constriction of the pupil is done using your iris, and your iris has two muscles in it. It has one that's more of a sphincter muscle that when you stimulate it, it will constrict. And then it's got a dilator muscle that when you stimulate that muscle, it dilates the pupil. I'll remind you that constriction, so pupillary constriction, is parasympathetic. Dilation is sympathetic. All right. Now there's a clinical connection here. If you've ever had your pupils dilated during an eye exam, those medications are typically anticholinergics. So they block the parasympathetic stimulation. If you block the parasympathetic stimulation of the sphincter muscle, the pupil will dilate. All right, and there's a number of them. Atropine is a very common anticholinergic, and there's a number of other ones. All right, so again, a little bit of a clinical connection. If you know how the autonomic nervous system regulates your pupil, you can understand this medication. All right, next tissue is adipose tissue. Now remember, one of the things you want to remember about sympathetic activity is energy. You need energy for fight or flight. You need energy for E situations. Exercise, you need energy. Emergencies, you need energy. So one thing that can release energy is adipose tissue. So you will stimulate that process with sympathetic neurons. So sympathetic stimulation of adipose causes the breakdown of triglycerides. So that's known as lipolysis. All right, lipo meaning lipids, fat. Lysis means you break them down. When you break down triglycerides, it releases the fatty acids into the blood, and fatty acids contain a lot of energy. So it's a way to mobilize energy. When you're at rest, you don't mobilize energy, you store energy. All right, now storing energy in adipose tissue, you just stop stimulating the breakdown. All right, so there's really isn't much innervation parasympathetic. You're just going to do the opposite when you stop stimulating it with sympathetic neurons. All right. Okay, next one is the heart. The heart's a great one because we kind of know what it does when we're at rest. We know what it does when we're, exercising. We know what it does if we're in an emergency situation. All right, so we typically can perceive what the heart's doing. So obviously the heart's job is to circulate blood. You have to circulate more blood during E situations. All right, because you have to circulate more oxygen and you have to circulate more energy, whether that energy is the fatty acids or glucose. So during sympathetic situations, again, fight or flight, E situations, sympathetic neurons increase heart rate and increase the force of muscle contractions. That will cause your heart to circulate more blood. All right, and you perceive that, right? When you're exercising, you could feel your heart beating harder and faster. If you were to, get in a car accident, that activates your sympathetic nervous system. Your heart rate's going to go up. Your heart's going to beat harder. At rest, all right, sympathetic activity goes away, parasympathetic activity goes up, and it slows your heart down. And that's due to the vagus nerve. Your vagus nerve slows your heart rate. All right, it releases acetylcholine that stimulates the beta receptors on your heart and it slows it down. I'm sorry, the acetylcholine receptors. The beta receptors are going to respond to the sympathetic stimulation. So let me remind you, your heart has beta adrenergic receptors that get stimulated by the sympathetic neurons and the epinephrine, norepinephrine in your blood. And then the heart also has acetylcholine receptors for the vagus nerve. Clinical connection, there's a number of drugs we call beta blockers. Beta blockers are going to block the sympathetic stimulation, and instead of increasing heart rate, it will decrease heart rate and decrease force. Anticholinergics, such as that atropine we looked at in the previous slide, can block the vagus nerve and increase your heart rate. All right, so that's the heart. Next one, blood vessels, also cardiovascular. Blood vessels get a little tricky. We're going to try to just focus on the blood pressure aspect of them. So blood vessels can regulate your blood pressure. They do this by what's known as vasoconstriction or vasodilation. So if we look at a blood vessel, kind of the normal diameter, if we were to vasodilate it, which is relaxing the muscle in the wall, that will lower blood pressure. If we vasoconstrict it, which is stimulating the muscle in the wall, that will raise blood pressure. All right, so how does the autonomic nervous system work? Well, we're going to just look at sympathetic. Now, again, it's more complicated than that, but when we're looking at blood pressure, just disregard parasympathetic. So sympathetic stimulation is going to cause vasoconstriction, which increases your blood pressure. When those neurons stop stimulating, that's going to then cause dilation. All right, so you either stimulate the muscle and it causes vasoconstriction, or you don't stimulate it and the muscle relaxes and the blood vessel dilates, and that lowers blood pressure. Clinical connection. There's what's called alpha-1 blockers. These are medications for hypertension or high blood pressure. What these drugs do is they block the sympathetic neurons, and if you block the sympathetic neurons, instead of vasoconstricting, you will vasodilate, and therefore instead of increasing pressure, this will decrease pressure. All right. Next one, your lungs. So what do your lungs do as far as energy? Well, your lungs bring in oxygen. So if you're in a fight or flight or E situation, you need more oxygen entering your blood. How do you do that? Well, a couple things. One, your respiratory rate will go up, but that's using somatic motor neurons. but you will also dilate the airways. We call that bronchodilation. So the small little airways, not really shown in this picture, these are larger airways. The smaller ones are called bronchioles. Those bronchioles have smooth muscle. When you relax the muscle, it opens up the airways. We call that bronchodilation. That is done using sympathetic stimulation. Parasympathetic stimulation constricts the airways and reduces the amount of oxygen that enters those airways, and therefore it can enter your blood. So at rest, your airways are constricted. During fight or flight, E situations, exercise, your airways bronchodilate. Clinical connection. There's a lot of ways to dilate airways. One is you just give epinephrine, right? So we can give the actual hormone that stimulates bronchodilation, epinephrine. We use an EpiPen. That's typically done in emergency situations when someone is experiencing anaphylaxis or an allergy that causes the airways to constrict. There's also medications that are beta-2 agonists, such as albuterol. Albuterol is probably the most common bronchodilator out there. It's used all the time during, respiratory problems such as COPDs or, bronchitis and respiratory diseases that might reduce airflow. So those are beta-2 agonists. They do the same thing as the sympathetic nervous system. We could also bronchodilate by blocking the parasympathetic. So we can use those anticholinergics. Some of them include the ingredient in Atrovent and Spiriva, which cause bronchodilation. All right, so very common medications. We've probably heard of bronchodilators, but there's more than just one way to go about opening up those airways. Next one, intestines and stomach. So typically, again, if you remember rest and digest for parasympathetic, you'll know that parasympathetic stimulates your stomach and your intestines. All right, and what we mean by stimulate is you increase the secretions. Those secretions are going to have enzymes, and if it's the stomach, it's going to secrete stomach acid, but also stimulate the muscle. We call that motility. So at rest, your digestive system increases secretions and motility. If you're in an E situation, fight or flight, you decrease secretions and motility. Pancreas is involved in your digestive system, but also in regulating blood sugar. So this is a really important one here. The more you can learn about the pancreas now, the less I got to worry about hammering at home when we get into A&P2. So one thing your pancreas does, and this is a very important topic because of its connection to diabetes, is it regulates blood sugar levels. So you need a certain amount of glucose in your blood. The range people typically throw out there is 70 to 110, and that's in milligrams per deciliter of blood. So basically you need blood sugar. If it gets too low, your pancreas produces a hormone that can raise blood sugar. That hormone is called glucagon. So glucagon raises blood sugar. You need blood sugar for energy, so that's a sympathetic stimulation. Insulin does the opposite of glucagon. Insulin's a hormone produced by your pancreas that lowers blood sugar. And what it ends up doing is taking the glucose out of the blood and storing it into cells. All right, thus lowering blood sugar, lowering that energy source. So you can imagine if both these hormones are doing what they're supposed to do, you'll have the appropriate amount of glucose in your bloodstream. So glucagon raises blood sugar, insulin lowers blood sugar. Glucagon is stimulated by sympathetic neurons. Insulin is stimulated by parasympathetic neurons. All right. The other function is enzymes. And again, if you see the word digestive, you know it's stimulated by parasympathetic. but inhibited by sympathetic. So during times of fight or flight and ease situations, you don't really worry about digesting food. You'd rather do that when you're at rest. Okay? Liver, that's another one we learn in AMP2, but let's talk a little bit about the liver, what the liver does. It's a store of glucose, so it'll respond to the previous hormones. It's a target of glucagon. It's a target of insulin. So if glucagon is being produced, it's going to tell the liver, take glycogen, which if you remember, that's a big giant polysaccharide. It's a stored form of glucose, converts it to glucose, which can then raise blood sugar. If there's insulin, we're going to take glucose out of the blood and store it as glycogen, and that'll lower blood sugar. So the liver is a target of those two hormones we just talked about that are produced by your pancreas. And then the other thing the liver does that's important for us today is producing bile. And as long as you know bile is a digestive secretion, then it should make sense that it's stimulated by parasympathetic neurons. Bile is used to help you digest fat. All right. Next one, urinary system. It's a lot like the digestive system. You'd rather do it when you're at rest. All right. There's no reason to activate the urinary system when you're in a fight or flight or an E situation. So we're going to decrease urine production, sympathetic, and then when you're at rest, urine production goes up. Your bladder is stimulated better when you're at rest. It's much easier to urinate when you're resting. It's pretty difficult to urinate when you're in an E situation. Now, there is a situation called paradoxical fear. So this is when you have such an extreme fear that instead of activating a massive sympathetic response, your body actually goes into a massive parasympathetic response. And you can lose control of your bladder and urinate yourself. You can lose control and defecate yourself. So that's called paradoxical fear. It's such an extreme fear that it actually activates your parasympathetic nervous system. But typically you're going to urinate when you're at rest because parasympathetic stimulation contracts the muscle of your bladder. Clinical connection, some people have an overactive bladder. You can kind of inhibit that overactive bladder using anticholinergics. All right, last thing is the reproductive system. Again, it's a late AMP2 topic, but an erection is parasympathetic. So the male and female erection is stimulated by parasympathetic neurons. Male ejaculation is a sympathetic response. Again, that's one of the E situation we're talking about there is excitement. All right. So notice that we kind of introduced a bunch of organ systems that you're going to learn about in AMP2. Hopefully that'll get you kind of started kind of thinking about these organs, but we're focusing on how the autonomic nervous system controls an organ when we're in an emergency situation or exercising or when we're at rest. Again, this is a topic that you got to get to the point where it just makes a lot of sense. And the only way to do that is to kind of know what the organ can do for you. All right, good luck. Reach out to me if you have any questions.